Good morning. In this session, we're going to discuss the capabilities of Hermes EMR to provide outcome measurements and trending. So to get started, let's log into Hermes EMR web portal. Log in. And the outcome measurement analysis tool is actually available under the Tools menu. Go under Tools, and then there is a statistical analysis tool. So just simply go here. And in this session, we're going to actually use CAFAS as the clinical outcome measurement tool. In the Hermes, basically any kind of measurement tools that provide numerical measures can be analyzed using the statistical analysis tool. So as you know, CAFAS does. So we're going to use CAFAS. Let's get the module is CAFAS. Okay, so double click on that. So what happens is, well, it will actually load all the CAFAS that are done on your student population, on your patient population in the recent time frame. Okay, so this is actually a list of all the CAFAS, both at admission and at discharge. Okay, so this is a list of the CAFAS. You can see each CAFAS. There is a date, and also there is various scores. Okay, some of them are done at admission time, and some are done at discharge time. Okay, this is a list of all the CAFAS. And to get to the outcome measurement is actually done very straightforward. You can just go down here, and there's a bunch of tools. Okay, you can also go by time frame. From and to. That let's say you want to do from January 1st to December 31st, and then that way you can filter out. So let's just go ahead and look at these different tools. Okay, list chart by gender. So what happens here is that you have a different scores, and this is total score at admission time and the most recent one. So you can see how the trending goes for both male and female, and overall, and different scores. You can see that the various scores in CAFAS, and you also can look at the total score, and that's listing by gender. You can also go by age. Okay, 5 to 10 years old, 11 to 15, and so on. Okay, and this all you can also have individual score trending. Okay, so is that, and most useful is probably this distribution chart. Okay, so what this shows is that at admission time, you can see this is almost like a normal distribution. Your score is probably around 120, and then most recent one, you can see it actually goes downward. Right? So this is a more useful way to look at your total patient population. Okay, and this also can go by individual scores. How the population have improved or not changed. So this is the an example of how one can do outcome analysis based on your medical records, your scoring on these using these outcome measurement tools. So thank you, and have a good one.